Zone 3 Podcast. I am Robert.
Yes, and I am Reggie.
And you are Laurie Coburn. Nice to meet you, Laurie.
I am.
It's
nice
our first
to
time
meet
meeting you.
Yes.
And you're from Utah.
Yes.
And you're from Weber State University, right?
I am. Weber State University.
And did you grow up in that area?
No, I grew up in Salt Lake, but Weber State was the best place to go if you wanted to learn about radiology.
Yeah.
And you might say, why did I want to learn about radiology? Because most people don't know about it, right? When you first, it was like, how did you come up with radiology? So when I was in high school, I was in a medical careers class.
Yeah.
And it was a great class because it let us go see all the different things. I thought I wanted to be a doctor at first, right? Everybody wants to be a doctor at first, right? But then I saw, all of these different areas. I saw nursing, respiratory therapy, all the different allied medicine fields. And I loved radiology. They let us go to the hospital so we could watch what each place did. I knew that being a nurse wasn't for me because they were kind of with one person the whole day, most of them that I saw. And I thought, well, I kind of like a little bit more variety than that. Right. And so I went one day into radiology, and they had an angio patient on the table. And it looked like a surgery procedure. And I thought, oh, this is really cool. And they said, oh, you can come on in. I'm like, really? I can come on in? This was the days before they kind of prevented people from shadowing so much. But so I went in there, and they, put all the lead aprons on me, gowned me up. And I just loved it. I saw them working as a team, and it was actually a heart cath that they were doing.
IR was kind of your first interest.
It was.
Okay.
And so I thought, I've got to find out. I said, well, how do I get into this? And they said, oh, well, first you need to do radiology. And I thought, well, isn't that taking, 2 views of a broken arm? And so then, they started me along the field of what radiology really was. And so
you started young then.
I did. I was a junior in high school when I knew that that's what I wanted to do. So it was awesome. Yeah.
I knew I just wanted to party in high school. I had no direction in life. And I'm jealous of people that did. And actually I hear about this story a lot from people who were like, they had some sort of a class, or they went to, they provided some opportunity where they were able to shadow. And I'm like, I was never provided that. And I think, man, I probably would have gotten a jump start if I had. I think
it was a great jump start for me. And I mean, my parents really liked it too, right? Because I wasn't in college for 3 or 4 years before I figured out that, oh, maybe this isn't what I want to do. So
yeah, and it's a good, a return on your investment of time, because it's a 2-year degree.
Right.
And from there, you start your career, whereas your peers, people you went to high school with, they still got 2 years left of their bachelor's there at University of Utah.
Right. Right. And they're still there. No, not really.
It's a good school.
It is a great school.
Yeah.
Yeah.
I had tons of friends that went there back when. You guys remember when they were undefeated and they went to the Fiesta Bowl? And they tore down the field goal, and they were walking it down State Street.
Yeah, I do remember
I was part of that.
You were?
Well, I helped carry it. Yeah. It's what is the statute of limitations on that one?
Yeah. It's got to be up by now.
Yeah. Well, so your career has just blossomed, right? So first you started in IR, and then from there.
Well, actually, I first started in radiography, because that's where we all start, right? Is radiography. And you learn a lot while you're in radiography, and you learn about patients and how to take care of patients and how to move them. I mean, it seems like, I think people who aren't in healthcare don't realize there's an art and skills in patient care that take a little bit to figure out. So yeah, I started in radiography there. Right when I graduated, this was back in the day when a private radiologist owned his own office, which is unheard of anymore, because that's really expensive, right, to own all of your x-ray equipment. This tells you how old I am. But anyway, I went and worked for a private radiologist in his own private office. And that was really interesting, because not only did I learn how to do all of the fluoroscopy procedures, general radiology procedures. But when you work in a private office, I also learned the billing for radiology. I had to do transcription. And this was back before we had computers, right? I used this great IBM Selectric 2 typewriter that you had to, every time you made a mistake, you had to go correct all the copies, so you learned to be a really good typist, because you didn't want to have to go, fix them all. And then I learned coding, because I had to, code like medical coding, so that we could send the bills out and they were billed right. So it was a great experience, because I got a very well-rounded idea of what goes on in
I
radiology.
think that kind of sums up your history. It's just well-rounded.
Well, I'd like to think so. I
Yeah.
hope so.
Yeah. So then how long were you in radiography before you decided to pursue the
So this doctor that I was working for, this radiologist, decided one day, this was when CT was a new technology. So again, tells you how old I am. But so he decided he was going to get a CT scanner, right? And he said, "Oh, Laurie, do you want to do this? Learn CT." So they had somebody come over from the local hospital to teach me how to do CT on the CT scanner. And the other thing about a private office is that the radiologist isn't always there, right? And so here I am alone, the sole person trying to figure out how to do CT, which also was a great education because you needed to start learning, okay, look, I saw this, he's not here. I think he's going to need me to do this, Or I'd have to call and say, look, I think you're going to have to come back because I need to give this patient contrast.
Well,
and I
that's
need
critical
you to be
thinking
here,
skills. Yeah.
right?
Yeah.
And so although it was, what I thought, oh, it's just a job in a little office, I'm really grateful that I had that chance because it taught me a lot of things that I don't think I would have otherwise picked up on.
Yeah.
So I did CT for a little while. And then there was a job opening at the local children's hospital, primary children's hospital. And I really liked CT, so I was going to do that. And they said, well, why don't you come over here? And guess what? You have to do graveyard shift first. So all of
Pay
us
your
probably
dues,
have
yeah.
had our turn, right? Doing graveyard shift in the morning portables, which again, I hadn't done that for a long time because I'd worked in this little office. So again, it was learning something new. It was exciting. And I found that I really loved working with children. So I worked there for a while, and then a CT job came open, and I got to do CT there for a while. So what came along, I don't know if you guys were cross-trained. It sounds like probably you were. They said, well, those who work in CT usually are cross-trained in interventional radiology. Would you like to do that? And I said, oh, yeah, that's what I've always wanted to do. So it was the perfect, again, sometimes you don't know that things are going to work out the way they do, but they work out because you're looking for them and trying to work hard towards your goals. So, yeah, the job in interventional radiology opened up, and it was what I knew I had always wanted to do. So I worked there for a long time doing that and eventually became the manager. And in those days, when you worked in interventional radiology, we shared the room with the cardiologist, so I learned cath lab stuff. So eventually, I became the manager over CT, MRI, sedation for MRI, the cath lab, and interventional radiology. So at that point, you kind of go from cross-training to leadership. It's kind of a career ladder, I guess, in radiology. And from there, I decided, wow, I'm over MRI, and I've never done that before. I need to know what you people do over an MRI. So I would tell you I don't know MRI physics very well, but I know enough, or then I knew enough, to get a patient done and to understand what a coil was and why this coil might be important when I was doing the budget next year, right? So I did that for a while, and it was great opportunity to learn something new again. And I guess that's how you could describe me. I just am always wanting to learn something new, right? And so after that, I thought, okay, well, now I kind of know all of these modalities. To be honest, management wasn't really my forte. I liked more patient care type things. So I thought, well, what can I do to keep, forwarding myself? And so at that time, Weber State was starting their RPA program. And I thought, oh, wow, that would be great because I could do some of these procedural things that I like to do. I could learn more. And so then I went to Weber State for their RPA program and did that for a while. And lo and behold, they had a job for me when I came back to primary children's as an RPA. So I worked as an RPA there for a while. And I don't know, I've got a long story about my career, don't I?
That was great.
You're ambitious, that's for
Right.
sure. Wow. That's an impressive resume.
Well, it's been fun. And after that, I decided, I've done this for a long time. And it's interesting, and we can maybe get into this a little bit further. As an RPA and an RA, There's not like one set scope of practice. You kind of mold into whichever group you're working for and what they're looking for. Right. So it was fun because I had to do a lot of things that I wouldn't have expected to be doing. For example, like helping the radiologists of the group with their IRB for their research. I mean, that was a great little niche for me because it was something that people didn't really love to do. And I thought, oh, look, I can do this. And I helped them that way. So there were other things from that I learned a lot from that experience as well. So after that, I've decided I did that for quite a while. I was just thinking about it this morning. I've been in radiology for almost 40 years now. So I like doing that, but as the older I get, I think probably most people know that interventional radiology is a very physically demanding job and it takes a lot of call. And I thought, okay, well, what can I do? And I thought, well, what is it about my job that I like so much? And one thing is that I like to teach other people and help other people learn things. So I taught as an adjunct for Weber State for a little while. And so I thought, well, I wonder if, maybe there'd be an opportunity there. And they said, well, yeah, Laurie, you've got your master's degree, but now you need to go back and get your doctorate degree. And I thought, oh my gosh, I'm an old lady, right? So I did do that. I went back and got my doctorate degree, and now I teach at Weber State. So
wow,
that's my story.
Yeah, that's a very impressive one, though. So I mean,
you just never stop learning, which is amazing.
Well, and that's me. That's who I am, right? That's what I like.
Yeah, that's awesome. So like, because a lot of people would have just been content along their way. I mean, when they became manager, they would have been content. When they became an RA, they would have been content. So kudos to you for pursuing things. So I guess, how have you found throughout the process your previous experiences helped you in the next one?
Oh, I think I couldn't be where I was today if I hadn't gone through almost all of these steps, right? Okay. I learned things that I like and things that I didn't like so much. I realized that, leadership seems to be kind of the career ladder in radiology, one of the career ladders. And I thought, that's just not who I am. I like working with patients more than I like working with people. So that helped along the way. Learning to work with physicians. When you work in interventional radiology, you work very closely with physicians. I, scrubbed in on tons and tons of cases with different radiologists and came to understand what it means to work as a team and maybe my role in that and how I can help other people as a team progress.
For sure.
I just learned a lot of stuff like that along the way that helped me kind of focus what do I want to do next? It helped focus me.
Well, so the topic of today's episode is that RRA program, and I guess the first thing I'd like to do is just define what that is, because I think there is some confusion on mine and other people's part. There's RRA, there's RPA, there's RA. If you could just kind of define the differences.
Okay, so the first mid-level radiology provider role did begin at Weber State University. It was college back then, but and what happened there was the military, the Army, went to the leaders of the radiology department at Weber State and said, listen, we need help. We need a mid-level provider who is kind of an advanced skills technologist who can help us so when we are not right where they are, they can get the imaging done that is needed so that we can be remote from them and learn from them. So that program started, that was the RPA program, and it is still going today. That was about 1990, I think it was.
So they're doing interventional things then? Procedures?
They're doing procedural things. Again, it really depends on what practice you work with and what they want done.
But like as far as scope of practice? Scope
of practice is you always have to work under the direction of a radiologist, under the supervision of a radiologist. State to state have different laws about what is okay to do and what is not okay to do. And also the CMS, the Medicare, Medicaid, has rules about billing. So it depends on what if you're working in an inpatient center or an outpatient center. And honestly, I couldn't tell you all the different rules of all the different states, but it's dependent on that. So that's one thing that makes it confusing to people because it's different in every state.
Is it similar to a PA where you can bill, like you get your own billing identification?
No. I mean, you could if you wanted to, but there's no real reason to do that because you bill under the supervision of the radiologist, so the radiologist bills.
Right.
So again, it is confusing. At any rate, the first one that was started was the RPA, and then later on the ARRT decided they wanted to start backing it. So they also have a credential, which is the RRA credential. And most people who are registered radiology assistants just use the RA credential. So it's the same thing. So there's really two main ones.
Okay.
And there's also, I mean, to make it further confusing, there are PAs that are just general physician assistants that work in radiology sometimes. So those are people who are trained more as a general medical person who oftentimes work in radiology.
So then I guess maybe I have been thinking about it wrong because I've always kind of just understood it as they are a PA, but a PA that works in the Department of Radiology.
No, different.
Okay.
Yeah, it is confusing because again, and also there's nurse practitioners who are also trained a little bit differently, and also sometimes work in radiology as a mid-level provider. So it is confusing to people.
So when you first started off, if you were an RPA, were you then grandfathered into an RRA credential, or did you have to then go back and get certified?
No, so I was an RPA until I came to work at Weber State. And Weber State wanted to back the RA program at this point in time because it had the backing of the ARRT, which is a national, place that would give us a little bit more backbone. And so I decided I needed to get my RRA credential. So yeah, I had to take the test.
Interesting. And then like that test, what is it's a registry, right?
Yeah, it's a registry test.
Okay.
It's about 250 questions long. When I took it, they had part of it was essay questions, like kind of a case study type thing they would give you information about a patient, and you would say, this is what I would do next. This is what I would do next. Now they have condensed that down. They still have a case scenario type thing, but it's multiple choice now. So.
And then what is the first of all, like maybe you do or don't know, but like percentage wise, what is like the passing rate for a person taking it their first time?
How hard was it? Pretty much.
Yeah.
It was hard.
It was hard, right?
It's a hard test for sure. At Weber State, I have been there since 2019, and we have I think it's a 94% pass rate, but that's not always the first time.
Right.
And that's what I tell my students. Okay, so first of all, you go into this test not knowing what it's going to be like, right? It's kind of like all the other modalities as well. So if you don't pass it the first time, that's okay. Figure out what it is you don't know, and then we'll study, and then you can take it again. So we have a fairly high pass rate, but it's not always the very first time they took the test.
How many times are you allowed?
3.
Okay.
And then after 3, you have to get more education again before to be able to requalify.
So it's not the end of the road, just...
No.
Okay. What is the required grade to pass?
75%.
Nice.
Okay. Yeah. As far as like that clinical hours that you have to put in for this, like what is the expectation?
So the program at Weber State is 4 semesters long.
Okay.
You do 24 hours of clinical work a week, and I have students from all over the country, so it depends. You have to work with your preceptor. You have to have a radiologist preceptor who agrees to be your mentor and be the one who helps you through it.
So placement's kind of already predetermined?
Yeah, because you have to come to me with, your preceptor and your facility where you're going to work. And the reason for that is it's a huge commitment on the radiologist's part. It's a big time effort for them. And typically I tell people the best thing to do is to get with a radiologist and show them that you're great and ask them to be your preceptor. It's hard for me to get a radiologist to commit to that amount of time when they don't even know the students. So that's why they come to us with that. I mean, we'll help them through the steps of it, obviously, but they have to know who they want to be their preceptor and, where they're going to work for their clinical
I
hours.
had some personal experience with that. I was working at a hospital where the radiologist there asked me if I would be interested in an opportunity like that and thought that I would be a good fit. And so I don't know if you know this outside of Utah, but you do at the time, I'm sure you do, because you knew that was the only school. But like Weber State University is known. It's not just like locally known. And it's known as the school that you would go to if you were pursuing something like this. And so it wasn't hard to convince me to move back to Utah. I love that idea. It happened to be right at a time when I was at a crossroads in my career and I was pursuing other options. And so it just didn't work out. But
Sure.
it's something I actually had a lot of interest in. And it stemmed from me, being scrubbed in on an arthrogram, for example, and watching like on a shoulder, watching them try to get into the joint. You work with 6 different rads and some get it their first try, some take longer than others. And I'm just sitting there thinking, just hand me that needle, man.
I know.
I think I could get it.
I know. It's true. And funny you say that, because when I was working as an RA at the Children's Hospital, I was the GI tube queen. And it sounds like kind of a funny thing, but you start to get to be really good at the things that you do all of the time. And so I would say I was probably faster than some of the other radiologists because I just did them all, right? So that was great for them as well, too, because then it freed them up to go over and read the MRIs or, do the other things that they were really great at. And not that they couldn't do it. And they were the ones who taught me to do it, right? But it was just because I had the
repetition.
The repetition, yeah.
So like if somebody were to want to get into this program, you mentioned it's 24 hours a week, but in total, how many clinical hours is required?
It is, I think, 300 and something a semester. So times that by 4.
Do you have to see a certain amount of procedures?
Yes. So I recommend, if it's something you're interested in doing, to go to the ARRT website and look under the RA credential, and it lists all of the things. There's 500 procedures you have to comp.
Oh, wow.
So
We'll put that link actually.
yeah, that would be great. And some of them are mandatory, some of them are elective, because obviously we know every hospital doesn't do all the same procedures. So, but it will tell you exactly how many procedures you need to do, and there's like a minimum number that you have to do, and then after you've done 50, then you don't keep counting them, type of
So
a
you're
thing.
doing like chest tubes and
Yeah, there's chest tubes.
were you doing kind of ESI type stuff?
No, not really. We did mostly, we do joint injections. I worked in pediatrics, so we did some joint injections. I started a clinic for the interventional radiologists and saw the patients before they came in for their procedure. Have you ever if you've ever worked in interventional radiology, oftentimes you don't meet the radiologist until 5 minutes before the procedure. So we made a clinic so that the people could come in beforehand. We could get to know them, review their history with them, and then I would do the follow-up things. So I would go, if we did a chest tube, I would go around on the patients the next day and make sure their chest tube was still working. Make sure, the stopcock wasn't turned off. You'd be surprised how
So
often
like
that happens.
legally you can write prescriptions for an x-ray?
Nope, we can't.
under the-
The radiologist would do that. Yep.
Okay. But they kind of give you free, I mean, it depends on where you work, right? But they,
It depends on where you work. And, some things you can do by protocol, like, just like in CT, by protocol, they write that you need to give contrast. So there's some things that there are protocols that you can follow. Sometimes the radiologist, typically what I would do was I would go up on the floor, look at the patient, make sure everything was working okay, look at their labs, see if they'd had a fever, see how much had drained out of the tube. And then I would put all of this information on all of our inpatients and bring it down and round with the radiologists. And then they were the ones who would say, okay, well, we think, this one we can pull the chest tube. Laurie, go pull the chest tube, things like that.
okay.
Because that kind of segues me to my question. Like, what we consider like a good day? Like,
A great day.
Yeah, what's a good day for an RA?
Well, let me tell you, it depends on what your background is, right? I'm an IR girl, so a great day for me was a lot of procedures, right? A great day for, the people who have an MRI background is going to be different. They typically would go do the fancy 3D reconstructions of hearts or whatever. I don't know enough about MR to know all of the things that you do, but that's one thing that as a teacher, it's really great because I have people with all various backgrounds. They usually have some modality specialty. Like I love it when there's a sonographer there because I'm not, it's not my forte. So if I have a sonographer there, she's showing us all how the best way is to localize your needle when you're doing some kind of a drainage procedure.
Yeah.
I didn't think about doing the post-processing because you're right. A lot of RAs do handle like cardiac post-processing, even though we have techs that can do it too. The rats can actually handle that as well. So I bet that'd be a perfect thing for, one of the RPAs to do is to kind of handle like, processing some of those complex workflows like that.
Are you dictating it all?
I personally didn't, but a lot of my students do. And they can't dictate the final report, but they can dictate a report to give to the radiologist who then reviews it. And
like a resident almost.
Yeah, it's almost like that.
Oh, that's
okay. And then like as far as the school experience, how long is it?
So it's 4 semesters. So you start in the fall. So you go fall, spring, summer, fall.
Okay. And then didactic, what is the expectations?
So didactic, it is, I think, 16 credit hours. At least at Weber State. I can only speak for Weber.
Then.
Yeah, it's full time.
So it'd be hard to work during something. And that's actually another
almost
reason.
all of my students still work.
Really?
Yeah, it's hard these days to not work and
see, somebody scared me away from that.
Well, she made a good point earlier saying that you have to bring that radiologist who's going to be your clinical search. So you pretty much already kind of know where you're going to work at. So you're probably working with them, working with their schedule.
And see, it works out good for them because they can train you to do exactly what they want you to do. So that works really well. So sometimes people do get paid to do some of their clinical hours just depending on who their preceptor is and where they are. And I mean, if your job is in, ultrasound, obviously you're going to have to do all of these comp procedures. So it depends on the flexibility of the place where you work.
You were the GI queen, but what was your favorite procedure to do?
Oh, my favorite procedure would be to do complex interventional procedures because they would always ask me to scrub in with them. And I love doing that because they'd bounce ideas off me because I did it a lot, right? And so they would say, oh, Laurie, I can't get this catheter to go here. Any great ideas? I've tried and tried. And so they would actually listen to what I, told them to do. So I love that.
Because I have no spectrum on like what's easy or hard when it comes to IR procedures. So what's like one of the easiest procedures to do?
One of the easiest procedures, probably like a paracentesis, just where you're draining, putting in a needle and draining simple fluid out. Right. I mean, not to say they can get complicated too. You're working sometimes with really sick people, just like anywhere. I think that's another thing that makes me like procedural things is that sometimes you've got to know things are going to go bad, and you now are the person making the decisions because oftentimes the radiologist isn't in the room right next to you. So that is a hard thing to teach people because typically people who come to our RA program are people who excel in whatever modality that they do, or they're a leader in a modality. When you're an RA now, you are the ones, you're not helping someone else, you're making the decisions yourself. And so you start out from being at a high level, and now all of a sudden you're making mistakes, and not only that, but you're working sometimes with the technologist who you used to be their leader, and they're like, come on, Laurie, can't you get that PICC line in, So it's a change that it takes a while for people to be able to, say, okay, it's all right if I am not perfect and not, a radiologist at this the first try. So.
Well, when you told your come up story, that's the first thing that came to mind is how comfortable you must feel in your own skin, because we all have that kind of imposter syndrome, and we're afraid to, not be high achieving in front of our peers. But yet you kind of went up and got to a certain point, but you were willing to come back down a little bit just to kind of humble yourself and learn what it was. But in that process, you're being seen, like, for example, as you're a manager of MRI department, now you're going to start learning MRI.
Right.
That's got to be very humbling.
For sure.
Yeah.
Right.
But it takes a really secure, strong person to be even willing to do that and jump in there.
Well, I've kind of learned throughout my life that I learned from failure, right? It's not terrible to fail. If you fail at something, then you learn from that and you think, oh yeah, well, I'm not going to do it that way next time.
Well, it's not that people are and I don't want to, it's not just that people are afraid to fail. They're afraid to see other people see them fail.
That's
True. That is true. And you kind of have to get over that.
Yeah. Yeah. Well, kudos to you.
Yeah, thanks.
I am curious, like, with the RPA program, RA, I guess it's all kind of synonymous at this point, right?
Mm-hmm.
What was the initial setbacks? Like, was it insurance? Was it billing? Was it just the hospitals recognizing your credentials?
Yeah, I think that's hard anytime you start a new profession. And we're still, in the growing pains of it, even though it's been since 1990 when the idea first happened. Initially, the problem was, I mentioned it was the Army that came to Weber State. So Weber State said, great, we can help you train these people. And they went to, the accreditation to get things accredited. And that's not an easy process. And they went, to the radiologists and got a curriculum developed. And they got this all ready to go. And then guess what? There was a budget cut. And the Army said, sorry, we can't
Never
send you. Yeah. So after talking to the community, they decided to move forward with it anyway. So I'm sure that was a big setback. I wasn't there at the time, but I'm sure that was disappointing for them. And it's like, we've gone through all this work and now how are we going to get students?
I would imagine also, like, you're creating a job from scratch. And so,
Yes.
like, there's employers that aren't even aware of this job. So then, like, how does the job market? Like,
Right. And so the radiologists went hand in hand. I mean, without them, I don't think this would ever have been possible because they're the ones who helped decide, well, what is it that they can do? Because I did run into some radiologists who said, what makes you think that you can do what I went to, 16 years of school to learn how to do? And I said, listen, I'm not trying to take over your job. I'm trying to help you. And there are things that, that are some of the putting an NJ tube or a GJ tube. If you can be reading your complicated MRI, let me do the things that I can do. And so I think that helped build the curriculum. I think part of the problem, one of the setbacks is then how do you bill for it? And they wanted to set the radiology people aside, set us apart from a generalized PA, not anything against a generalized PA, but typically most PAs had no background in radiology.
or healthcare at all, actually, sometimes.
Sometimes, yeah. And I'm not saying that there's not a place for them. There definitely is. I would not think that I could go into an optometry office or wherever it is that they learn to work and do their job. I just think that I happen to have a big background in radiology. So we thought that was important to kind of distinguish that, make us a little bit different from the nurse practitioners and the PAs, because guess what? We were the people that the radiologists were working with all along, right? But then how do you do the billing? And then there's the CMS rules, and there's so many billing rules. That was another part in my radiology. I did end up at one point being a certified radiology coder because I needed to figure out how the billing part worked so that I could,
Do you just have the alphabet behind your name as far as credentials go?
Oh. No, I don't. But I guess that's that's how I handle maybe not looking so great sometimes, when you're learning something new, is that I try and then learn it. And I do whatever I feel like I need to be able to learn it. So anyway, the setbacks are partly due to the billing because people don't know what is, and radiologist groups want to make sure that they have accurate billing because there's a lot of penalties if you don't do that right. So I think, that's been one of the setbacks, but it's coming along better and better.
Making a comeback, right?
Yeah.
Is it competitive to enroll there at Weber State? Like, are you guys have an acceptance rate? Like, are you turning people away?
Well, we don't really turn people away just based on numbers of people, because we'll take, the people that apply if they have the right background. So you have to now, in order to be able to sit for the RPA board or the RRA boards, you have to have a master's degree. So that means when you're coming into my program, you have to have a bachelor's degree first. And honestly, if I could give people any advice, would be get your education so that when you want to do this, you're good to go and you can move forward.
Do you have to have an RT at all?
You do have to have an RT.
Okay.
And you have to have 2 years of clinical experience as an RT.
What would be, I guess, the benefit of going that route versus the PA route, I guess?
It depends on what you want to do. I mean, you could, I do have a lot of friends who are radiographers who decided they wanted a more generalized, broad medical background education. And if that's what you want, then that's what you should do. If you want to mainly work procedural and do things that, we do in radiology, I happen to think that technologists have a great background to do that. So, and if you want to be the person who is the person sedating patients that we're doing, then maybe the nurse practitioner is the route you should go.
I see.
And is this just a national thing, or is this outside the U.S. as well?
You have to have an RT from the ARRT. So I'm not sure. I only know of one international person, and I don't know if they, lived here and moved.
Right.
Just because you have to have an RT.
And what are the governing bodies?
So the ARRT is the credentialing body. ASRT has some of the curriculum, helps with the curriculum for that. So they help govern. Obviously, the state where you work governs it. The radiologists have a part in that. The ACR, helps endorse and goes through the curriculum and what they think it's okay for RAs to do.
And so with that credentialing, what are the CEU like?
Oh, yeah. So the CEUs are, you have to have 50 continuing CEUs every 2 years. And then you have to do the every 10-year quality thing, just as
CQR.
CQR. Yeah.
Nice.
And are people grandfathered in on that one, like there are with MR? Because I missed it by one semester.
Yeah. I didn't miss it, thank heavens, for IR, but I'll have to do it. It depends on when you took your board exam.
Yeah, okay. Because people are going to wonder, like the job market, we talked about the needs, but as the salary goes, what are the expectations with that? Somebody should...
Yeah, I looked that up because I thought you might ask me that question. So there is a society...
A range, I would imagine, but...
Yeah, there's a range. There's a Society of Radiology Physician Extenders who did a survey in 2023, and the mean was around $137,000. And the range I saw was anywhere between $80,000 to $200,000 plus. They didn't go, break that down any further. And it typically, I was looking at their data, and it typically depends. It seems like people who are more experienced or have worked in radiology longer, they're at the higher end typically.
What is the cost of the school?
Cost of the school is about, I can tell you Weber State. I don't know any of the other schools, and there are other great places around. So just so you know, Weber State is about $24,000 for the whole program for tuition. I mean, obviously there's books.
Right.
You're going to have to travel to Weber State.
I paid more than that for my RT, man.
I know, right? That sounds amazing.
Yeah. They give out-of-state people really the same deal. I mean, you can get a scholarship, and so you get in-state tuition. So that's another really nice
Yeah, I was
thing.
wondering about that, like grant opportunities and stuff like that.
Yeah.
Okay, cool. As far as what's the ceiling? I mean, what growth opportunities? Once you've reached that level, is the next level a radiologist, or is there other opportunities?
Well, I think you make your own opportunities at this point, right?
Well, you're a fine example of that.
Well, that's what you have to do, right? I think for me, it was going on to get my doctorate degree and work at, teaching. But there's so many, again, there's no real set scope of practice. It's all working under the supervision of a radiologist. And there are, again, at the ART site, it tells you what common procedures are done by people who are new graduates. So you can look there to kind of get some ideas, but I think it depends on what you want to do. I could have been a researcher, really, because most the radiologists that I worked with were required to publish every so often, but it wasn't their favorite thing. They liked doing patients.
Right.
So, they let me help them with their research projects, which was really fun, and I really liked that. Not everybody does, but another person I know loves to do, stuff with mammography. She likes the patient interaction in mammography and works helping do like the biopsies and things. So really, I think it's what you make it.
Right.
With the school itself, like, what would you say is, and I had it right here. I'm sorry. Give me one second.
Sorry.
How many schools, and I don't really expect you to know the exact number, but if you had to make a guess, how many schools would you say?
And there's about 5.
Okay, and it started with Weber State.
It did.
At the time you said it was Weber State College, but it's now Weber State University. Is it I've never been there. Is it a large campus?
I don't know. I think it's a fairly large campus. It's right up on the mountains of Ogden, Utah. It's beautiful there. Really
And there's
pretty.
you mentioned military. There is is it Air Force Base up there?
Yeah, Hill Air Force
Yeah,
Base is right down the street. We have
So
the jet flyers fly over the college every day.
So if you wanted to come and attend, you could, live there in Ogden, ski at Snow Basin. Sounds like a
Yeah.
great opportunity.
Yeah.
I thought it was more than a year long. Actually, so the thing that scared me away from it was one of them was somebody said, well, you can't, which is interesting to me because you mentioned a lot of your students work full time. Somebody told me, because I have children, I'm like, I have to work. I can't just take off time and go back to school. They said, well, they equated the analogy that they gave me is like trying to obtain all this information or retain it, I should say, is like trying to drink from a fire hydrant. So I was like, oh really? Wow, that's like so they're like, for you to do that and go to school full time or go work full time is not really an option.
So most of my students work full time.
That's reassuring. Yeah.
That brings me to my question. Like, for people who are actually like thinking about doing this that are technologists, what is like one of the main reasons why people don't make it all the way through the program?
Well, if you think about it, especially if you don't know your preceptor very well, and you're new to the facility that you're at, I think it's really hard sometimes to realize that this is, a 4-semester job interview, right? They're going to be watching you, and you have to be on your game. And even if it's somebody you know for a long time, I worked with radiologists for a long time, but there were days where I didn't do very well. And you have to maintain a professional level and be able to take criticism because you're going to do things, you're going to make mistakes, let's be honest. You're going to make mistakes. And that's really hard sometimes, especially for both sides. If you know somebody really well and you worked for them for a long time and you are their main left-hand person in getting all their supplies there, and then now all of a sudden you're doing a procedure and they say, what were you thinking? You've got to kind of have a little bit of a tough skin. Right. And be able to take criticism like that and move forward. That can be hard for people. On the other hand, if you don't know your preceptor and you don't really fit into what they want you to do, that can be hard as well.
So really, before even thinking about kind of going that route, you should have a conversation with the radiologist that you think is going to be your preceptor.
Yes, definitely.
For sure.
And like where you're at, I guess, because that's where you're going to be.
Because you're locking it in.
Right.
And do any of these schools, like these preceptors, do they like help to sponsor any of these students?
Yeah, some of them do.
Awesome.
Some of the groups pay for them to go to school, so then they don't have to work full time. Right?
So they'll sign like a year or 2 year long contract.
Yeah.
Yeah. Awesome. Yeah. Well, you're an inspiration.
Oh, well, thank you. That's sweet.
I find that a lot of times if you just apply yourself and you're determined, man, sky's the limit, and you've proven that. So good for you.
Yeah. Thank you.
So we're going to ask you what we ask everybody. And given your 40 years of experience and your so many different titles and so many different roles,
I know, right?
I had a lot of great days.
Yeah.
Is that what you're going to ask me?
What would you say is the most fulfilling moment? It might be just
Fulfilling moment.
like a moment that you shared with one specific patient, or it might be a job that you
Yeah.
had.
Well, I can tell you two. So, again, the interventional radiology is kind of my baby. The thing about interventional radiology is, and if you've worked there, you will get it. Kind of like, when you work in MR, you get certain things. When you work in interventional radiology, there are some days where the teamwork just clicks. You don't have to talk to each other really. You just know what's going to happen. And there was a patient who came in as an emergency, and we were doing a cerebral angiogram. They'd fallen down and they had a pencil sticking out of their eye, and they were worried that, it got one of the major vessels in their brain. And, it was a child, right? So that makes it even more pulling on your heartstrings. But for this angiogram, we were all there on call. It was late at night, and everything just clicked. It just went boom, 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 boom. And I thought, there's nothing better. This is just like a dance almost. You know what the next person's going to do. You don't really have to ask anybody about it. So that night was amazing.
This might be a stupid question, but were you able to save their eyesight in that night?
Actually, the pencil missed every major vessel.
Amazing.
I know.
Sound like you were working with the 98 Bulls, though.
Yeah, and you were Jordan?
Right? No, it was a cool case, but you have compassion for your patients. But the other thing was I was a GI queen, right? So the GI tube queen, and so you have patients who come back again and again, right? And one day I was just out shopping with one of my kids, and this little kid came running up and gave me a big old hug and said, "Laurie, I get to see you somewhere outside of the hospital." And they knew who I was.
And your kid got to see that.
Yeah.
Oh,
Yeah.
that's awesome.
So I thought, I hope that, you can see that what you do can make a big difference in somebody else's life.
I would love that experience.
Right.
Yeah.
My kids, man. Good for you. That's awesome.
Amazing.
I think this is going to be a great episode. Like I said, a lot of people have a lot of curiosity on this topic. So, Reggie, are we missing anything?
I guess. What's your phone number so they can call you if they have any questions about it?
Weber State. Look at Weber State.
Yeah, and if it is okay, and feel free to say no, but we may put some of your contact information.
Definitely, yes.
We'll put that in the link.
Contact information.
Yeah.
Yeah.
All right. Well, Reggie.
Yeah, thank you guys, of course, watching week after week. We really appreciate the support that we're getting. If you guys have anything to add or any questions, please feel free to leave a comment. We'll try to get to all those if we can.
Subscribe, do those things that YouTubers tell you to do. Yeah.
Thank you guys for inviting me. I appreciate
Thank you
it.
for
It was
coming.
great.
Yeah, awesome.
Thank you.
Well, Reggie, Zone 3 Podcast.
We are out. Good.
Awesome.
Nice. Oh, man.